Good evening, friends. Today I'm going to explain the radiology of thorax. Important. So here, first you must say the type. It is plain type, and which view. It is a posterior anterior view. Unlike upper limb and lower limb, which was a anterior posterior view, in the thorax it is a posterior anterior view, PA view. And the region, if you ask, it is chest region or thorax region. Okay, why it is important for the PA view? Because accurate assessment of heart and cardiac size and cardiac shadow should be and will be clear in the PA view, unlike AP view. So here in the X-ray, you must keep in mind four features, that is by the mnemonic ABCD alphabets. A, coming to the A, airway. So here in the first X-ray, here you can see a light opaque. Here there is opacity, which suggests the consolidation infection in pneumonia. Okay, first is trachea, airway. Here you can see the black, dark structures. This is the shadow for the trachea, airway, for the air to pass. And next, coming to the breathing, B for breathing and bones. Here you must see the opacity, lung size, and recesses, and you must see the diaphragm. Here in the first X-ray, you can see the actually lung should have come like this, but here due to the opacity, by the infection of pneumonia, it has been decreased by the mass presenting inside, and due to which the heart border is also decreased, is not prominent here, which leads to heart diseases also. And coming to the next X-ray, here you can see, coming to the breathing and bones, and here bones also you are prominently seeing the scapula, glenoid cavity, clavicle. This is coracoid process, acromion process, and you can see the ribs, and sternum also somewhat visible. This is the head of the humerus, right? This is the upper shaft of the humerus. These are the bones visible. And coming to the second X-ray, here also all the bones, clavicle are visible, and apart from that, you can see here this part. Before that, you can see this right hemidiaphragm and left hemidiaphragm. Okay, or the right shadow of the right dome of the diaphragm and the left shadow of the left dome of the diaphragm. So here another thing is you can appreciate this angle. This angle is called a costophrenic angle. This is phrenic, means diaphragm. This is costal surface, costophrenic angle, which is most dependent and which forms the costophrenic recesses. Here, most dependent for the pleural effusion. Any fluid accumulation will go here and accumulate and increase the what angle gets obliterated depending on the amount of fluid. How much fluid directly proportional. More the amount of fluid, more the angle obliterated. And this is and you can also see this cardiophrenic angle here. Here cardiac will come, and this is cardiophrenic angle. This is the most dependent site, costophrenic angle or costophrenic recesses. And next, coming to the circulation. Circulation, you can see the heart. Here you can see the right border of the heart. This is the left border of the heart, and here you can appreciate the cardiac notch. and this downwards. Here dark portion is there, no, that is called lingula, which says that this is a left lung and this is a right lung. And you can see here another notch. This is the shadow for the arch of aorta. Here there will be arching of aorta, okay, also called as aortic knuckle. And as I said before, this is cardiophrenic angle. Coming to the next X-ray, this is a clinical aspect. They have written dextrocardia. That means the heart is formed in the right side. Here this is a problem. Here you can also see the cardiomegaly. What is cardiomegaly? How you can measure it? Actually, the mediastinum, this measurement between the two lungs should be less than the half of the measurement of the thoracic cavity. Okay, thoracic cavity, if this is thoracic cavity and this is half, and this measurement should be less than. Okay, see here I have written, if the heart width is more than the width of half of the thoracic cavity, then it is cardiomegaly. Here you can by seeing only you can say that here it is somewhat enlarged cardiomegaly, and also dextrocardia, where heart is in a formed opposite side, that is right side. Coming to the next X-ray, here you can see the right lung is completely opacification is severe here, and even in the left there are some opacity, but more severe in the right side. It is caused due to the pulmonary edema and bilateral pneumonia. Here also you can see the cardiomegaly taking place, because the two width of the here mediastinum or the heart is more than the half of the width of the thoracic cavity, this thoracic cavity. Here also in the next X-ray, opacity you can see here. This is due to the acute respiratory distress. Okay, and also here in the next X-ray you can see this tube. This is a nasogastric tube which is inserted here. This is of pediatric X-ray. Now at last, this is normal. You can see, appreciate the cardiac notch. Here you can see the aortic notch, and this is lingula. This is angle recesses. This is right border, left border, hemidiaphragm, both side, and this is trachea, and bones you can appreciate. This is about the cardiomegaly, but this is not the case of cardiomegaly. This is normal. What is cardiomegaly? I have explained here. That's it. Okay. This is of normal. Okay. Now this is about the radiology of thorax. In the next class, I will be discussing the radiology of abdomen and pelvis. So, hope you understood. Thank you.